The gluteal region is the posterior thigh down from the level of the iliac crest, which provides attachment for its first deep fascia, the fascia lata. The posterior root is the entrance for vessels and nerves of the gluteal region, and remember that's in the greater sciatic foramen, which also permits the entry of muscle to the thigh via the piriformis, attached to the sacral bone and travelling through to insertion on the greater trochanter of the femur, but via the greater sciatic foramen. The lesser sciatic foramen, or lesser sciatic notch, permits entry of the obturator internus muscle, which travels from the ischiopubic ramus, or the obturator membrane, through to the greater trochanter again. The perineal vessels and pudendal nerve also go through this region, with the neurovascular bundles wrapping around the ischial spine, which act as the boundary between the two foramina. And the gluteal muscles are attached onto the external surface of the iliac bone, which presents three lines called gluteal lines, showing where the attachments are: posterior, anterior, and inferior gluteal lines. You should be familiar with the natal cleft, gluteal folds, and bony landmarks for the posterior superior iliac spine and the greater trochanter of the femur. The gluteus maximus muscle is a main extensor of the hip and is attached to the whole posterior gluteal line of the ilium. It has two insertions, one to the gluteal tuberosity on the upper shaft of the femur, and the other into the iliotibial tract, the long lateral reinforcement of the fascia lata. It's innervated by the inferior gluteal nerve, which comes directly off L5 to S2, and the extension of gluteus maximus, the extension of the hip, comes only into play in more strenuous exercises, so not in walking, but in moving up from a seated position or climbing stairs. The walking extension of the hip is provided by the hamstrings. Because of its action on the iliotibial tract or iliotibial band, it's also able to help with extension of the knee, an action which is also assisted by another muscle, tensor fascia lata, which is up here, which is supplied by the superior gluteal nerve. And though the muscle aids in extension of the knee, it is itself a flexor muscle of the hip, and the action on the tightening of the fascia lata is secondary in movement of the knee to the main contractions provided by the quadriceps of the anterior thigh. Hip abduction, moving the limb outward, is performed by gluteus medius, inserting into the gluteal surface of the ilium and extending right out into the greater trochanter of the femur, and then attaching slightly further down between the anterior and inferior gluteal lines is the gluteus minimus, which also performs the same action. That's hip abduction. Remember the posterior and anterior and inferior gluteal lines on the inside of the ilium. Both of these are also supplied by the superior gluteal nerve. Trendelenburg's sign is the mark of paralyzed abductor muscles of the hip, i.e. gluteus medius and gluteus minimus, and is characterized by the pelvis sagging on one side, since these muscles normally prevent the sagging to one side because they work in antagonism. And this is often caused by a crushing injury to the lumbar nerves, which breaks the one side of the gluteal nerve, superior or inferior, superior in this case. This commonly happens when an intervertebral disc herniates, allowing its centre to move backwards towards the spinal cord and crush the nerves, affecting the spinal nerve on the one affected side.